former classmate of mine. I hope she can do it, she's really good. But this is more specific. This is more specific just to exercise, okay? So keep that in mind. Is it coming? Maybe. They're at the very bottom. I didn't want to start foot and ankle today because we're not going to get through foot and ankle today. And then I won't see y'all for God knows how long. So I figured just do these and then we'll do the beer. I found them on that canvas.
Which ones?
Geriatrics first.
4 inches.
There's like 4 of them together. Geriatrics, obstetrics, lymphedema, and relaxation. No.
251?
251.
What? Like they should be on here, and I think you just have to like.
Yeah, they're not published.
You have a lot of pros.
You have to share them with us.
Yeah, you have. Sorry. So that tells me how prepared y'all were beforehand. Anyways. So geriatrics. How many people genuinely enjoy working with geriatrics? I don't. Put my hands down. Even though I'm about to join that demographic.
Because some of them are really sweet and really like appreciative, and then some are really old and really mean and really cranky
Yep.
and just mad that they're not as independent as they used to.
Absolutely, absolutely. Couldn't agree more. You'll get the best stories from this population for sure. If many of them, and my wife will talk to you at length about this, this is their social outlet.
Yep.
Yeah, really.
And they want to pour out everything to you. And what you need to do is just nod your head and say, yes, sir, yes, ma'am.
It's so
Yep.
sweet.
Yep, they'll tell you anything. But it's a very important population, obviously, for this profession. This pays the bills. If you're in an outpatient clinic, unless you're seeing a bunch of athletes and stuff, this is what you're gonna see. These are the people you gotta take care of. So, lots of benefits of exercise. So, how's exercise gonna help us from a cardiovascular standpoint when we're older? Heart's a muscle, you gotta use it, right? Lowers blood pressure. Okay, all these have been proven.
That's for brain function.
Yeah, well, I mean, we'll get to cognitive stuff too. Helps with lipid profiles. So obviously, a lot of these folks have cholesterol issues and things like that. Exercise is going to help with that. Musculoskeletal, countless ways it's going to help. But think about strength. Think about osteoporosis is a huge problem for this population, especially the females. Exercise can help prevent that. When it says OA, osteoarthritis, how does exercise help with arthritis? That's an interesting statement. Forces the bone to become stronger. Well, what part of the bone is the problem with osteoarthritis? The end part, yeah. So, I think you're right in some regards, but yeah, I would think that more along the lines of healing. But I don't know that you can directly say exercise improves osteoarthritis. I don't know that it does. I don't know that you can reverse osteoarthritis, but it certainly can slow the progression, and we can take some stress off of some joints by doing some other things, right? Yeah, well, there's no doubt about that. No doubt about that. But I'm talking about the pure physiology of it. You're probably not going to reverse, I know you're not going to reverse the effects of arthritis, but hopefully we can slow it a little bit, yeah.
Would it reduce like any pain that they're having from being like stiff and like mobilizing the joint like that?
I don't know. I don't know that you can say that. So I have bad knees. Every morning I wake up, whether I exercise or not the day before.
So like with the movement, does it get
hurts
better?
stiff.
when
Yes,
you move?
it does, absolutely. So it's all relative degrees too. We're not talking about benefits of exercise. We're not talking about this person running a marathon. We're talking about, hey, getting up and moving around, doing sit to stand. All that can be classified as exercise. Endocrine system, insulin sensitivity, diabetes, huge part in regulating that. Very few people who exercise on a regular basis have problems with diabetes, flat out, okay? You're probably gonna have a genetic disposition if that's the case. Metabolic, obviously, weight loss is certainly and that would help tremendously if people did more. I would much rather have some stiffness and achy joints than be obese. And then here we go with the psychology. We know all kinds of studies say how much exercise means to not only cognitive retention, but also just a sense of well-being, a sense of purpose, okay? So make sure your parents, your grandparents, whatever, encourage them to be active, okay? I come from my side of the family, pretty active. My wife's side of the family hates to exercise, hates it. So we go on vacation or something like that, and I want to go to the gym, or I want to go ride a bike, or do something outside. They want to read books. It's like we were talking about. And I'm like,
Don't put me in that.
that's fine. You can read your book, but can't we go do something too? You know. So be an advocate. You know, promote this. This is part of your job as well. All right. You know, if you really want to think about it too, obviously the independence is a big part of it. Decreased fall risk. We talked a lot about balance, or Roseanne talked a lot about balance a couple weeks ago. Think about how balance is affected by every one of these systems as well, okay? If you're diabetic and you have poor sensation in your feet, your balance is going to get affected, right? If your metabolism is such that you get lightheaded and so forth because your sugar drops way low, you're gonna have balance problems. If you are weak, if you are physically weak, are you not gonna have more balance problems and more propensity to fall? Yes. So again, all of these things, I'm not saying they can be prevented, but so many of these things can be avoided or maybe seen later in life if we would exercise. So again, please be advocates for that and make sure that you continue to promote this in the profession, because that's really where it's at. Contraindications. Severe arrhythmias. My mother-in-law has AFib. Again, she hates to exercise. Now she'll tell you that she's very active, like cooking, cleaning, gardening, all those kinds of things. And I guess she is. But again, she doesn't stress her body in any way, if you ask me. I wish she did more of that, because I think it would help her heart too. Unstable coronary artery disease. If somebody exercises and they have chest pain every single time they exercise, they're probably not going to exercise, okay? And nor should they. You got to do something there to get that fixed. And in end-stage congestive heart failure, they're not going to want to exercise, because getting up out of bed is going to be taxing to them. Okay? These are people that you'll see tremendous amounts of swelling in their extremities. Their lungs are just really stressed with fluid. They can't breathe very well. That's really tough. That's really tough. Monitoring vitals is huge. So what are we gonna look at? In an outpatient clinic, what should we look at if we've got somebody with some of these issues?
Blood pressure,
Blood pressure,
pulse ox,
heart rate, O2 sats, yes. What else? You're forgetting one that I think is important. We just talked about it.
rate of perceived.
Rate of perceived exertion, Borg scale, 6 to 20, okay, is a really, really good tool. Been proven to work over and over, okay? Don't forget about that one. Don't forget about that one. I like to ask that as much as I like to ask pain. I hate asking pain ratings. And you've been in the clinic now, a lot of people will ask every single time somebody comes in, what's your pain level? What's your pain level? I mean, we're grading off on you if you don't ask back. But in a chronic pain situation, that's not something I want to bring light to. I want to diffuse that as much as I can. But I do want to know how they feel about exertion, okay? Super hot day outside. Somebody's got to park and then walk in the building who's got some of these issues here. If they come in and they say they're a 14 on the scale, is that going to affect what I do? Absolutely, it should. And you don't always have to know that it's a 14 on the scale. You can look at them and tell that, right? What would you see?
Out of breath.
Out of breath, sweating,
Pallor.
flush. Just got that, their whole gait is just like shuffling at this point. They can't even lift their legs up, okay? So you gotta be aware of those things. Warm up and cool down, we've already talked about that. Frequent rests, avoiding high impact, all right? So give me 5 exercises that we can do that are low impact cardiovascular type things.
Walking.
Walking,
Bike.
stationary bike, stepper, okay? Sometimes hard, but they have steppers also that sit. What's the name of that one that you see a lot around here? New step, yeah, new step, okay? What else? Elliptical?
Oh, is that an elliptical?
What's that?
A UBE?
UBE? No. But it's another one that you can use. Yep.
Just making sure.
Yep. So impact things are difficult for this population. You got to consider that. Common barriers. These are all pretty much common sense, but something you got to think about too. Discomfort, not just pain, but difficulty in breathing, stiffness. So do we want to just decrease the intensity all the time? It depends. Depends on who you got, what their goals are. Cross training. You get somebody who, so I had a guy a couple weeks ago, he's like the pickleball king. And he's talking about his hip bothering him. And I said, well, I know you play pickleball. How much did you play yesterday? And he said, 6 matches. I'm like, that might be too much. But you know what? Because of the other slide we just had, am I going to tell him to stop playing pickleball? No, that's crazy. It makes him positive about his life. So, you're going to see this in this population a great deal. Fear of injury. That's my mother-in-law. She will say over and over, I'm going to get hurt if I do that. Well, you're right, because you've fallen and it's the vicious cycle. She's fallen because her balance is poor and her bones break because she doesn't exercise. So lots of obstacles there. All right. Self-efficacy, we talked about that. We've got to make sure, again, that we give them a sense of worth of what they're doing. I love it when they come in and they're going to tell me about they did this, and they did this, and they did this. That's great. I mean, you can really sense somebody has pride in what they've been doing when they're gonna come into the clinic, and they're probably hurting as a result, but they're gonna keep doing it, okay? That's our job, to get it to where we can manage it. You may have to titrate it a little bit, but keep them active, Don't set people down, if you can. Cognitive decline, we talked about that. You may need to keep things really simple. One of my favorites is for balance. I'll tell them when they brush their teeth, try to do it on one foot. Okay. But you know, working that into every activities of daily living can be really good. Fixed income, here's one. Hear that one all the time. There's lots of ways to exercise for free. Way too many that should not be a huge barrier. But again, be an advocate for your patients. Know that there may be a silver sneakers program where they can pay $10 and go to the Sportsplex, which is a phenomenal, so y'all been there, phenomenal facility. There's all kinds of walking trails around Auburn, Opelika. I don't know much about Valley. But anyway, learn about the resources that you have in your community and be an advocate. Using household items, that kind of makes sense. Using soup cans. I'm big on, if they have stairs, to use the stairs, because everybody's scared of stairs, and so they avoid them. But let's use them properly. Let's teach them how to do lunges, how to stretch properly, gastroc soleus, hamstring stuff off a stair. Use those things, okay? Fatigue and illness, we already talked about, trying to paint a picture of benefits more than detriment as best you can. Obviously, there are differing range of intensities that we can talk about and we can demonstrate. Just use your common sense with that kind of thing. Effects of medication. Now, this is a big one. It's one I probably don't do enough. You're gonna see when you deal with somebody who's 70 years old, the list of medications that they're gonna be taking is like this, most of the time, okay? Do you know every interaction that can occur with each one of those 11 medications that they're taking? No, that's not reasonable. But should you know the ramifications of the major ones? Amlodipine, what is amlodipine? You know what that is? Amlodipine is for reducing blood pressure, okay? It's gonna make them a little bit more lethargic. So if they've taken that in the morning before they come to you, they might be a little bit suppressed. So their blood pressure might be lower, but they might just not be feeling very good either, okay? Lots of different things out there to think about. All the arthritis meds, okay? You need to know about those. That would include things like Mobic, Celebrex, non-steroidals, so ibuprofen, Nuprin, ketoprofen, all those types of things. Those are the ones that we need to be able to say, okay, you're taking this, we need to do something about that, okay? Or at least I need to know what potentially could be a side effect of that. They take 12 Advil before they come see you, and then their stomach's upset. That happens sometimes, because they think more is better. More is better. Goals. Again, common sense. Well, do they match up with their goals? Now, this is something that I don't do a good enough job of doing. But always ask them, and PT should definitely do it. PTA should follow up behind it. What do you want to achieve out of therapy? A lot of them will just say, I just want to hurt less, okay? Well, let's make that into a functional goal. I want to hurt less when I play pickleball, or after I play pickleball, whatever the case may be. But again, I'll look at that list 1 through 4. If I'm going to rate them, I move this one to number 1 for most people. Because if you are weaker, it's going to affect everything else. So I try my best to strengthen everybody that comes in, okay? Because it will all work together. All these all work together. I think strength is huge. I don't think it's addressed enough, to be honest with you. And there's our balance progression. This is what my wife will kind of talk to you guys about a good bit. Going from seated to standing, bilateral to unilateral, static to dynamic, eyes open, eyes closed, different surfaces, perturbations, all kinds of different things. Different assistive devices, what have you. All right. Be an advocate for these people. I will be one of those people. We'll need help.
Hard one?
Let's move on to lymphedema.